In our practice, we use lots of cutting-edge technology. The first is that we use a 3D CBCT X-ray. A lot of orthodontists will use a 2D X-ray, and that's what's traditionally been taught and used for many, many years. But here at Gupta Smile Studio Orthodontics, we want to see the whole picture. And in order to do that, we need to use a 3D X-ray so we can see how teeth relate in 3D space, but also so we can look at the airway, both the upper airway and the lower airway. That 3D X-ray allows us to show the patient on the screen exactly how their teeth look from different angles. If there's any issues, any sort of cysts or anything that might be developing, we can point that right out to them. And we can show them if there is an airway constriction, exactly where it is and what that looks like on the screen. A 5D scanner is the latest technology from Invisalign and iTero. It's basically a scanner that allows us to see the teeth in all dimensions. Along with the traditional scanner, it allows us to see this teeth on the screen, but it also allows us to give 3D simulations of how a patient's teeth might look like at the end of treatment. We can take a video of someone casually talking, and the scanner can actually create a video that shows them what their smile will look like and what their face will look like when they're talking once their smile has been fixed. I love my iTero scanner. I love the technology, and it allows me to do the best for my patients. How I use a 3D scanner in my office is from the start of the patient experience to the end. When we first start, we take a scan of every single patient. This allows me to create a simulation for them so they can see what their final product might look like. It also lets me show on the big screen what their teeth look like from different angles. Then during treatment, we take progress scans to make sure that we can see how their teeth are progressing. We have a tooth movement comparison tool that allows us to show where the teeth started, where they've moved so far, and where we project them to be at the end. And at the end of treatment, we take a scan so that we can create a retainer for them from our 3D printer here in the lab.